Welcome. Today I'm gonna discuss more of Depo-Provera injection. What's Depo-Provera injection? How it works? What are the benefits of using Depo-Provera injection? And what are the common side effects of using this Depo-Provera injection? And when do you conceive after you have stopped using a Depo-Provera injection? Stay tuned. If you are new, please subscribe to get more of these videos. Let's get started. Now, when I talk about Depo-Provera injection, this is a method of family planning that's injectable and it contains the hormone, that is given after 3 months. So this, you can get a shot either intramuscular, I mean the muscles, or what we call the subcutaneous, that's under the skin. Now, that's what we call a Depo-Provera injection. Now, how does it work? Now, we need to know that it prevents, the release of the egg. So if it prevents the release of the egg, now there is no fertilization that will take place. The other thing is that it thickens, the cervical mucosa. So this part, it prevents the what we call the sperms passing through the cervical to the uterus, to the fallopian tube for fertilization to occur. So that's how it prevents what we call pregnancy. Now, what are the benefits? Once you decide that you are going to use Depo, the healthcare provider has explained to you what's Depo, and you have decided that you will use this method of family planning. Now, what are the benefits? Number one, it's very safe. It's very safe, very what we call effective, and it's what we call convenient. So once it's used very well, so this is one of the benefits. It prevents pregnancy. So you see, so this is also another benefit of Depo-Provera. The other thing is that Depo, it decreases the risk of what we call the iron deficiency anemia. So when you are using this method of family planning, so the risk of having iron deficiency anemia, they are very, very low. The other thing is that there is a decreased risk of having what we call the endometriosis. This is the condition that affects the what we call the endometrium. That's the inner layer of the uterus. The other thing is that this Depo-Provera, it just contains progestin hormone. So it doesn't have the estrogen hormone in it. So the risk of having what we call the deep vein thrombosis, they are very low. So these are what we call the benefits of what we call the Depo-Provera that one needs to know before taking this method of family planning. Now, we also need to understand what are the common side effects. Remember, this Depo-Provera, it has also the side effects besides the what we call the benefits. Now, what are the common side effects of this Depo-Provera? Number one, you may experience the irregular bleeding, so you may have irregular, so this is one of the commonest side effects. The other thing is that you may experience heavy, menses or lighter menses, or is spotting, or you may never see it. So this is also another common side effect. Once you have started using this method of family planning, you may have these side effects. Either there is no menses, or you have it in heavy, very irregular. So these are the common side effects you need to know. Also, you may have headache, weight gain, nausea. Sometimes you feel nauseatic. So this is also one of the common of the side effect of Depo-Provera. The other thing is a mood swing, dizziness. So these are the common side effects of Depo-Provera. Now, what are the disadvantages of using this Depo-Provera? So you need to know that Depo-Provera doesn't offer protection against the sexually transmitted infection. So you need to use a backup. Either you use a condom to prevent yourself if you are at risk of getting sexually transmitted infections. The other thing is that it needs 7 days to be effective. Once you get a shot, you need to take 7 days so that you can start practicing what we call the maybe unprotected sex. So it needs 7 days to be effective. The other thing is that this long-term use of this Depo-Provera, it may cause what we call the bone loss or what we call the osteoporosis. So you need not to use it for a long period of time. So these are the what we call the disadvantages of using this Depo-Provera. The other thing that we need to know is how long can one conceive, after using this Depo-Provera. Now, this may take long time. It takes 9 to 12 months for one to conceive. However, it differs in various women, but the research shows that the 63% of the women, they conceived within, or they regained the what we call the fertility within 12 months. The other research shows that the 83% of the women regained back their fertility within what we call the 15 months. So you need to know that after stopping this what we call the Depo-Provera injection, you need to know that it may take long period to gain your what we call the fertility. So this is what we call Depo-Provera injection. So this is a very good method of family planning. You need to go to the hospital to be explained these side effects, the benefits, so that you can decide which type of family planning are you going to use. So if you like this video, just subscribe, leave the comments. Continue